Good afternoon, everyone. My name is Leslie Fontenot. I'm Managing Director of Black Health Matters, and I'm delighted to bring you this session today. The session is going to be on sickle cell in our community, and we have two beautiful, lovely speakers that have dedicated their life to this disease. So let me start out a little bit by setting the stage, talking about sickle cell disease in African Americans. Sickle cell disease is an inherited and blood cell abnormality. It's more common with African Americans, although we know other races do get it, including people that are Caucasian. In the United States, sickle cell disease affects roughly 1 in every 365 Black babies that are born. And according to the CDC, about 1 in 13 African American babies were born with a sickle cell trait. It's a chronic condition that causes severe pain in children and adults who have the disease. And with me today is two individuals that I know pretty well. They have been dedicated their lives to it, as I mentioned. One is Beverley Francis-Gibson. She's the president and CEO of the Sickle Cell Disease Association. And I don't know how you have time to do anything else, because when I read her bio, I was like, my God, she's on every board, organization, everything. You know, you're sickle cell everywhere. She's on the board of directors of the ARM Foundation for Cell and Gene Medicine. She's a member of the Sickle Cell Disease Medical Education and Innovation Steering Committee and Advisory Board, member of the Maryland Statewide Steering Committee on Adults Living with Sickle Cell, which is so important. And Beverley Francis-Gibson is currently a board member of the Global Patient Advocacy Advisory Board on Sickle Cell Disease, a member of the Sickle Cell Disease Coalition and Sickle Cell Steering Committee. She is the recipient of several leadership awards and recently received a certificate of congressional recognition for her advocacy efforts. And congratulations to you on all of that, all of the things you do. And then we have the lovely also Mapillar Dahn. Mapillar is here in Georgia, and has been inspired by her 3 daughters who battle sickle cell disease. Mapillar Dahn founded the MTS, My 3 Sicklers, Sickle Cell Foundation, a nonprofit organization to bring awareness to sickle cell disease and provide support to families affected by the disease. Since its inception in November of 2015, wow, you've been working hard, right? The foundation has hosted photo shoots for sickle cell families, sponsored over 100 children battling sickle cell disease to a week-long summer camp. She's prevented families from being evicted and are getting back vital utilities, hosts fundraisers and activities, including your annual kickball tournament to bring awareness to sickle cell disease. Mapillar has also received several awards and recognition as a result of her years of service and commitment to the sickle cell community in Georgia. She currently serves as a member of the ASH Research Collaborative Patient Engagement and Education Subcommittee, as well as Global Blood Therapeutics CBO Advisory Board. And I would love for you to join me in welcoming Beverley Francis-Gibson and Mapillar Dahn as they share their perspective on sickle cell disease and its impact in our community. Thank you so much for being here, ladies.
Thank you so much.
Thank you so much. It's an honor to be here, Leslie.
Definitely. So I thought I would kick it off by asking the audience, how can you make a difference in your community, and how can you be the difference in your community? Because I think Mapillar is an example of someone who I met several years ago, and she, to me, embodies exactly that topic, right? So I work for a patient advocacy organization, which is SCDAA, and we were created to provide national leadership on issues impacting individuals living with sickle cell disease and their families. And we know from the introduction that Leslie gave that sickle cell disease does not get the attention that it needs. And so I am very happy that Black Health Matters and the Kappa Health Summit included sickle cell as one of the important topics today. We provide support for advocacy, policy, programs, and also activities that support 53 chapters that SCDAA has across the country. And our chapters, our member organizations, are the ones that provide direct services, information and referral, and advocacy to families locally. And as Leslie said, sickle cell disease is inherited. It's an inherited blood disorder. And I would be remiss if I didn't tell the audience that I am also a family member. In my own family, and I grew up in the Caribbean, I have a cousin that died from sickle cell disease when I was in high school. But in my own family, it was not discussed. And fast forward to 2019, as president of SCDAA, I am attending a conference when I get a text message that my brother has sickle cell disease, but no one in my family had ever even told me this. You know, they had reached out to me regarding other health complications that he has, but they never said it was in conjunction with sickle cell disease. And so we know that there are lots of complications that individuals living with sickle cell disease encounter because the red blood cell becomes hard, and it therefore makes it very difficult for those cells to travel throughout the body and travel and provide oxygen. And so with the hardened cells, we have individuals who are experiencing amazing and undescribable pain. I think one of the warriors that I spoke to recently describes it as having cut pieces of glass going through your body. And I cannot even imagine what that would be like or feel like. But just imagine that for a minute. That severe pain prevents, warriors from living, a normal life. Respiratory problems, organ failure, stroke, and other complications that this disease causes makes it very difficult for individuals to have what we would call a healthy lifestyle. And so I define good health as the ability to be free from pain, and that it allows you to enjoy and achieve your dreams and your aspirations. But don't get it twisted. Many sickle cell individuals are living their dreams. They are achieving despite complications due to sickle cell disease. But what I would like to challenge the audience with today is how can all of us collectively advocate and empower patients to be their best selves? And because I believe that many of us are part of networks and connections that we don't use. And people will often say to me, so what can I do? How can I help, Beverly? And I say that it is important that you first understand what it is like to live with sickle cell disease. So although I am a family member, I could not express for you or to you what my brother lives with every day or my cousin lived with before he passed away. But I do know that many warriors, as individuals living with sickle cell like to be called, are champions for their own care. And we encourage them to do that and to share their stories. We encourage them to become experts on their own healthcare and to understand who is ultimately making the decisions that impact them. We encourage them and us and you to listen, because in listening, you also learn. And in listening, you can also understand. And also admit what you don't know. I think sometimes we come in thinking that we already know, but not all sickle cell patients experience sickle cell disease in the same way. And it is not a box that everyone fits in. And I think sometimes, in our country, we try to put everyone in a box, and I would say stuff them in a box, and then tell them, prescribe to them what their care should be. But patients know what they need. They know what their lives are like. And rather than telling them, we should partner with them and work with them to ensure that our healthcare programs and access to care are better. We know that many of the issues that patients also face is what I call the white coat syndrome. So you walk into the room and you're, meeting a doctor, and the white coat, the professional, knows more than you do about your care and your health. And so what we see across the country is that individuals are not believed when they show up at the ER needing help or they're in a crisis. They're not listened to. I have had patients text me on the weekends that they're being escorted out of the ER where they go for help by police because they're not believed, or that individuals living with sickle cell disease have to dress up and appear a certain way in order to be recognized and to be believed. And in 2021, that should not be the case. I would also tell you that in 2021, we only have 4 approved FDA medication for sickle cell disease. And while there are lots of therapies in the works, we shouldn't in 2021 only have 4 when you compare it to other diseases across the country. So I started off by asking, what can you do to help? I believe that all of us have a role to play in our community. And what we can do is to start to be champions for sickle cell disease and for individuals living with sickle cell disease. What that means is that you can volunteer. There are lots of organizations like Mapillar's organization in Atlanta, and like I said, the 53 organizations that we have across the country that are working hard every day to help individuals living with sickle cell disease. You could start off by becoming a learner, an active learner, and engaging with communities where sickle cell disease is the topic. You can be selfless. And what I mean by that is volunteering and giving of your time, your talent, and your treasure to help sickle cell disease warriors in the US. But you have to earn their trust. It's a relationship. So like everything else, you have to spend time in the community understanding what's going on and then building trust. And then what I also referenced a few minutes ago is use your connections, your networks, your partnerships to help leverage better services and care for sickle cell disease patients. And I believe that ultimately, if we do work together, we can create greater synergies throughout our communities for the fight that individuals and families living with sickle cell disease face every day. And that ultimately we will have a cure for sickle cell disease in our lifetime. I would like to close by quoting a Greek proverb, and it states that a society grows great when we plant trees in whose shade we shall never sit. So think about that. A society grows great when we plant trees in whose shade we shall never sit. And so I want you to know that we can do this together, because our country currently is facing a number of social, health, and economic ills. But if we're working together towards an intended goal or objective, my belief is that we can come together to find solutions for the sickle cell disease community. And I will turn the floor over to my partner, Mapillar.
How do I follow that? I am so inspired by you, Beverly, and all of the hard work that SCDAA does for the sickle cell community, my family, and families all over the country. I love that quote that you just ended with, because I always feel like I'm originally from Liberia, that's West Africa. And I always feel like the work that we do here is not just for us. So for me, as a mother of 3 kids that have sickle cell disease, even when my kids are cured, the fight still continues, because there are so many people relying on us to continue that great fight until they too can get that hope of being cured or having therapeutics to help them live as normal a life as possible. And as you said, we just had newer therapies introduced into the sickle cell community after going decades of no new medication, having one medication for so many people whose conditions affect them differently. And, you know, just my family having 3 kids, with the disease, I get to see how very differently it can impact people who have, quote unquote, the same type of sickle cell. So I feel like you hit on all of the things that I had to say, but just the importance of self-advocacy. I am impacted by sickle cell, no doubt.
Yes.
As a single mother with 3 daughters who we are in the trenches of this disease, what really inspired me is a conversation that I don't feel is being held a lot when it comes to sickle cell, and that is the socioeconomic impact. That is very much a symptom of the disease.
Yes.
Families struggle daily to be able to maintain. Adult patients, caregivers, for everybody watching, sickle cell disease is just so unpredictable. You know, we've had situations where we're planning to go vacation or to meet family out of state, and I have one daughter who is having a crisis. We have to go to the hospital while the rest of the family goes on with the trip. And typically when sickle cell patients are in the hospital, you're looking at a week, at least for us, it's at least a week. But I know families, I know patients who are in there for months on end. And that
Yes.
really inhibits your ability to care for your family, your ability to pay your rent, afford utilities. So it is with that backdrop that I founded my organization. Of course, we're very passionate about awareness. Very early on, once I realized what sickle cell was, once it hit me, it dawned on me that we were not talking about it, and that's the worst thing we can do for this condition.
Yes.
Because with education, we're empowering families to make decisions about how they will conduct themselves. And especially being in an African community, even though I'm in the United States, within my African people, we don't talk about these things. So I was very intentional in talking about sickle cell on my social media, and just basically educating without really making it seem like I'm educating whenever something was going on. A lot of people did not know that sickle cell is the leading cause of stroke in children.
Yes.
And so when my daughter, when she was 7 and she had stroke, and I'm talking about it, I'm chronicling the different issues that she's having, her speech impediment, having, she lost the ability to walk and having to go through physical therapy and having a major brain surgery that had her out of school for a whole month. And just all of the different issues. I've been very intentional in educating our audience. Like, this is what sickle cell is, and bringing them along. And what I found
Mapillar, can I also say, when you shared the story of your daughter having a stroke in the classroom,
yes,
and because her teacher didn't recognize this as a complication or a symptom of sickle cell disease, there was no immediate care, right?
Absolutely. Absolutely. I was not told. Nobody knew what was going on. And it wasn't until I saw that she was exhibiting, it was just weird what was happening, because she was relying heavily on her left hand. And I know that she's not left-handed. And so I thought, because I knew she was predisposed to stroke. Sickle cell patients in this country are tested annually to see, they do a TCD, transcranial Doppler, to see if they're susceptible to stroke. And I was like, she may have had a stroke. And so, just going to the hospital and trying to get them to test to make sure, we did find out that she had a stroke. But that also has made, because before she had a stroke, she was pretty asymptomatic, So it's always something that I try to get people to understand now. Just because a patient, sickle cell is not a visual disease. And that's one of the main things we struggle with in this community. because even when patients are in the ER in so much pain, they are not believed because
their
there's no
pain
blood.
threshold is also higher.
Right.
Right.
They have built exactly. They built a tolerance. But for my daughter at the time, she hadn't had a pain crisis. She was pretty asymptomatic, all things considered. She still has sickle cell, but she's never had a pain crisis. So that being complicit in a way, and just seeing our kids as one of just the regular kids, and not making sure that they're not overexerting themselves. They're taking breaks if there's any kind of PE, and just keeping hydrated. So I just try to let everyone know that has any kind of connection, interaction with my kids, that, okay, let's keep an eye on them. These are some of the things to watch out for. Yes. But just navigating life with my kids and the struggle, understanding the struggles that this disease entails. That's really what led me to create my organization, so that we can position ourselves to be able to help families. So we help families with rent, utilities. We have parking passes at our local Children's Healthcare of Atlanta. We have food vouchers. Just really any kind of support that we're able to provide to families, we try to do that.
Yeah, and I think one of the things that we should touch on, because it is so relevant, is the COVID-19 pandemic and how it impacted sickle cell patients all around the country. And I remember last year in March, April, when the pandemic was full blown, a number of our patients talked about increased anxiety of the unknown. And all of us were having anxiety, obviously, because we didn't know anything about the pandemic and what it really meant. But I found that for the sickle cell disease community, the isolation of having to stay indoors and not be able to actively go to school or go out to work or do the things that we, that we normally do, I found that heightened some of the mental health concerns that we heard around the country. Did you experience that, Mapillar, with your families?
Absolutely. I think the mental health piece, definitely. And I feel like COVID-19 just kind of, it shined a very bright spotlight on some of the deficiencies that, if gone unchecked, because for us as a family, not that we weren't trying to go to the hospital, but we were trying not to be out there. So if it's not pressing, and I know that's one of the things that was recommended, try to, see if you're able to take care of the pain at home. Only go to the ER as a last result. So even with the clinics, they were doing telemed if they absolutely had to, but they weren't recommended that we go in. And one of the main areas that we struggled with was my youngest daughter, because because of sickle cell, she has had a number of silent strokes, right? And it hasn't impacted her to where, her mobility is affected, or any other overt things that we associate with stroke, but her neurocognitive abilities, her academia, she struggles academically. And COVID-19 just it shines such a bright spotlight on that. And we've had to, she was re-diagnosed with a mild intellectual disability. So we had to navigate what that means for us as a family. And she had issues, now she sees a therapist once a week, just to help her cope with the different changes that are going on. But for us as a family, that's something that I feel that's the biggest thing that COVID-19 did, was shine a spotlight on that need for her.
Nationally, the health disparities were really elevated, and like you said, it really shined a bright light on what families and individuals were facing before COVID, and then with COVID, right? And I know a number of individuals who said, I'm not leaving my house, I'm not even going to work, even when employers started reopening, families and individuals were very hesitant to go back to work, and it makes sense.
And I had families who called me looking for advice because they did not want to go back, but they were being threatened. Their jobs were being threatened. And I was just encouraging them, because here, our local hospital was really on the side of the family members, because they understand that, okay. And for me personally, I know that because my kids are a member of the vulnerable population, that makes me a vulnerable population. But not every state or not everywhere is sensitive to that. So there are a lot of caregivers, especially whose employment would threaten, or some of them lost their jobs because they just did not want to, chance that.
Yeah. One of the things that our SCDAA's medical research and advisory did, the committee did during COVID, was they met every Friday. And as we were getting information directly from patients and families and caregivers, that information was being shared with them so that they could develop advisories for patients, for caregivers and providers, because many people just really didn't know what to do. And we even did some advisories on the mental health component. And we did one on, going back to school and what that means, and how can parents advocate for their children with the school system. And then we did one on employers, because we heard that was becoming a bigger issue as well, to your point. But I think telemedicine and telehealth, also we saw some good and bad things, so it reduced travel time for families to get help. But I also heard from a patient, she traveled by bus 2 hours to get to her doctor, and then she had her 7-year-old with her and wasn't told that she couldn't bring her 7-year-old. So she gets to the provider's office and they can't see her. So she had already traveled 2 hours by bus. So I think telemedicine, telehealth also helped in that way, because families could still access care as needed from home or from the comfort of wherever it was, was helpful for them without having to travel long distances. Did you hear that as well in Atlanta?
Well, not so much that, but I know a lot of people, what I wanted to speak to was, especially in the beginning, us trying to figure out what to do, how patients should look at going to the ER. I remember, and we lost some sickle cell patients during that time, because sickle cell crises do not stop because of pandemics. And, trying not to catch COVID, trying not to risk that, and not really understanding, which is almost always the case. You just don't know how this crisis is going to be. Crises are so quickly escalated. So in trying to figure out how to navigate COVID, we did lose some warriors.
Yeah, we did. And that was also unfortunate, because what we know is that many of the warriors also just refuse, because of how they're treated sometimes, to go to the emergency room right away. And so they wait until the last possible moment, or until they've exhausted all other efforts to alleviate their pain crisis before they will go to the ER. And that's actually sad, I think, for us to be in a society where people feel like they can't go because of how they're going to be treated.
And I just feel like, it's so amazing that we have all this energy surrounding sickle cell in terms of the newer therapies that are being developed, but something we have to really work on. And you spoke to that in the sense that the perspective of the sickle cell patient, that expertise that the patients themselves have when it comes to the disease, which a lot of times they're more of an expert than the doctors, because a lot of these doctors do not know about sickle cell. Instead of it being respected and welcomed, when sickle cell patients try to advocate for themselves, they're kicked out of hospitals, they're blacklisted. They are just it's really sad what's happening to sickle cell patients all across this country when they try to advocate for themselves. And that is something that we recommend. I'm raising my kids. to be able to advocate for themselves. But,
Yes.
just seeing what is already happening when patients try to advocate for themselves. If we don't work to fix that, then all of these therapies that are being developed really, I don't want to say it's for nothing, but patients are not going to want to go and seek care because
Yeah,
they're
and I
not
think
respected,
sometimes,
because they're not.
yeah, I
Go
think
ahead.
sometimes too patients are afraid that they will be labeled as difficult.
Yes.
So they don't speak out. They don't, they
Mhm.
don't say anything, because we've also been talking to patients when they've been mistreated about, how do you file a grievance against, the nursing or the staff or the doctor, so that the administration can understand what you just experienced.
Mhm.
And many patients don't want to do that. They're like, I
Yeah.
just want to be relieved of my pain.
Yeah.
We don't want to file. We don't want to, or I don't even remember who was treating me, because I was in a crisis at the time. But I think the larger conversation that our community needs to have is, how do we engender a group of people who are trained medical staff to be not only compassionate for sickle cell disease patients, but they also continue to learn about sickle cell disease patients, because we know that that's not taught as well as it could be in medical schools, right? And we could be
Absolutely.
here all day talking about all the other issues related to sickle cell. But I think for the audience joining us today, I use you, Mapillar, as my example of someone who is living and making a difference every single day. And your daughters and your story that you shared with me, I use that story because it stayed with me when you told me a few years ago about your daughter's stroke, because I could not believe that a child was experiencing something like that and no one knew to help her.
Yeah.
But your passion, your drive, your energy is what actually helps to fuel me. And I want you to know that. And I'm inspired by you because of the work that you do every single day on behalf of not just your own family, but all the families in Atlanta.
Thank you. And if I can just piggyback off of what Beverly was saying in terms of what the audience can do to help. Because my daughter had a stroke at 7, the main therapy that has prevented her from having another stroke is monthly blood transfusions. So that is where you all can help.
Yes.
Because sickle cell patients tend to need frequent transfusions, in order for them to get blood every month, their blood has to be cross-matched so that their body receives it better.
Yes.
And we try to get away from the fact that sickle cell is not a Black disease, because that has not helped us with funding or awareness. But when it comes to that, race is important. That's where race comes in. My daughter's donor is going to be an African American. So because sickle cell predominantly impacts us in this country, it's important that we plead with our people to donate blood, and encourage your friends, neighbors, families to donate as well, because there's a whole population of patients who predominantly look like you, who are relying on your blood to lead as normal a life as possible. For those same reasons, I want to encourage you all to join the bone marrow registry.
Yes.
Look up Be the Match, or you can text Cure SCD to 61474 to learn how you can be someone's perfect match. There are so many sickle cell patients who are needing matches, but the blood and the marrow registry are not that diversified enough. Our patient population has barely any chance as it is right now.
And there is a national shortage right now of blood across the country. We have hospitals that are telling us that they do not have enough blood to treat patients when they come to the ER or to the hospital needing transfusions. So Mapillar, I am so glad that you brought that up as another way that the audience could give back and they could help, because blood is something that all of us need, but for the sickle cell disease community, it is even more so. So I think our session is ending. But I think that would be a great way for us to challenge and to encourage the participants of this session to donate blood and to help patients whose lives you're saving just by doing that single act.
And even if you're not able to donate or you're not able to blood or be on the registry, you can encourage others to do so.
Yes, yes. Thank you.
I think there are some questions. Who's feeding the questions? Chat. There's a Q&A.
Yeah.
I'm trying not to get out.
Yeah, I am. I think the person who's assisting us was supposed to help us with questions.
Okay, so let me, I can ask the questions, can I?
Yeah.
Okay, it says, can your child have sickle cell if only one parent has the trait? No, the answer to that is no. So in order for a child to have sickle cell disease, that child has to have inherited the sickle cell gene from each parent. So if you have the trait, it's like AS, that's the trait. And so 2 traits mean 2 of the S's the child has inherited 2 of the S's from each parent, and that's what forms the disease. So if one parent does not have the trait or the disease, because if you have sickle cell disease and you have a child with someone who has the trait, there's a higher probability of that child having a disease. So if one parent has no trait whatsoever, there's no way that you can have a child with the disease. If anything, that child will have the trait and not the disease.
And there's a question about whether or not there's a national commitment to eliminate the word drug seeker, as in addition to unimaginable pain crisis, and now have to deal with the emotional pain of being referred to as drug seekers. So I am involved with the Emergency Room Physicians Association, and they have been going across the country trying to educate professionals, providers, about how to treat sickle cell disease individuals when they come to the ER, but also on the words that we use, because words have power. And so there is a national effort underway, and we are working in partnership with lots of other groups to actually address this.
Okay, another question. I'm going to feed that to you, Beverly. Well, it's more of a comment. It's not a question. It says, we participate in the walk every year and hold a banquet. Thank you. And this is from VTAL. And thank you so much for that. Thank you for doing what you can in your capacity to educate and the community. So
yes, our national walk was just held last Saturday. So it was really wonderful to have the support from the community.
Okay, so the next question says, I was at a health community event a few years ago, and the representative that was there at the sickle cell booth had a daughter who had the disease. She knew that she was a carrier of the gene and said that had she known that her husband was a carrier, they would have adopted instead of passing it on. I thought that was a profound statement and was wondering if that is a common sentiment. I think that is something people feel. I'll answer that question with my situation without trying to get emotional on here. It's not something I talk about much, but I found out I had the trait when I was in high school. But in learning that, there was barely any education. Like, I took a blood test for a physical, and it said, you have the sickle cell trait. Like, I remember the term, but there was nothing urgent enough to make me, a teenager, pay attention to this and pay attention to my future progeny or whatever. So by the time I was pregnant with my first daughter, I knew of people who have the disease. And for the 1 or 2 people that I knew, they were constantly in the hospital. But still, I didn't understand what that meant until I got my first diagnosis. And for me, I was like, oh my gosh, this is how my child is going to be. She's going to be in a hospital, and just heartbroken about that. So I went to Google, and Google was my friend in trying to educate me on how this disease is passed on. But I think something else that we don't talk about that needs to be talked about, and this is even within the sickle cell community, there's this misconception that sickle cell skips generation, meaning there's no way all your kids are gonna have the disease. If one has it, the others are gonna be fine. And that was definitely the case with my children's father, because his parents had 5 children and only one had the disease. So that gave him the, reason to continue to go on, and some other stuff that I would prefer not to say. But I think we have to fight against that too and educate people. So that's why I'm like, you know what, God, if this is what you needed me to do to make an example of me, because that's why I say with every pregnancy, if mom and dad both have the trait, with every pregnancy, there's that possibility that their child can have the disease.
25% chance.
Yes, 25% chance. There's a 50% chance that the child will have the trait, and a 25% chance that the child will not have the disease. But with every pregnancy, the odds are the same.
Yeah.
What I
find too, Mapillar, is that if we continue to educate across the country, that people need to know their status, because what we learn is a lot of people have no idea whether or not they have trait or not. We can't stop people from having children, but we can better inform their decision to have children.
Yes. And I love that you said that. I love that you said that, because I feel like my job is not to tell anyone what to do in the comfort of their bedrooms. Exactly. My job is to empower people with that education, and knowing that even if your child is born with sickle cell disease, whether your child is not born with sickle cell disease, I am here to support you. I'm here to support you with education. I'm here to support you if you do have a child with sickle cell disease, and also to let you know that it is not the death sentence that position that I was in, where like that 3 times brokenhearted, just thinking my kids are gonna just have the worst lives ever. Right. That's not always the case. It affects everyone differently. And to know that there are therapeutics on the horizon, there are cures on the horizon. Even if you do have a child with sickle cell disease, there is support, there is hope.
Yeah, there are lots of support groups across the country, lots of organizations like Mapillar's and others that are helping families every day, so they don't have to walk around not knowing what to do. I know we only have 2 minutes left. Mapillar, I don't know if we have any other questions.
I think there's more. I'm trying not to get out of this meeting, but there are some more questions.
Okay.
We're trying, you guys. Hold on, let me see. Because it's right next to the leave.
Yeah,
button.
It's not letting me scroll up to see the other questions. I know we have other questions in the chat.
We do have some other questions. Okay, maybe you can get the ones in the chat, but I'm trying so hard.
I am technology chat.
Okay, there's what it says. Do all of your children have? Yes, all of my children have sickle cell disease. So that was an easy question. Are your children's record flagged to let all providers know that your children have sickle cell disease? I wouldn't know, because for now, all of my kids' care is in one network. So that network, they do know that they have sickle cell disease. But even if they did not, that's where I will come in. And whenever we're in a situation, just to let them know that that is their diagnosis. For example, one of my daughters, are we done? Are you good?
Yeah, he says, sorry, we have to end.
Okay.
So we can go to the networking lounge. But thank you everyone for attending this session and being a part of our
Thank you.
conversation on sickle cell disease. Mapillar, is always a pleasure.
It's always. Thank you so much. Have a great rest of your day.
You too.